I don't know about you, but when I see a cat with significant anemia, I feel several things, and optimism isn't really one of them. Well, that is until I recorded this podcast with feline specialist Dr. Rachel Korman. See, my lack of optimism stemmed from a bunch of anemic cases early on in my career that didn't have what you'd call happy endings. And to be honest, I think this influenced how I've approached these cases over the years, perhaps with a little bit less drive to solve the problem. Well, if you're nodding along going, yeah, me too, here is Dr. Rachel to hit the reset button for you.
One of the things that we found from that was that the severity of anemia for cats is not something that's predictive of survival. And I think that's really important, because you might have a cat with a PCV of 8% or 10%, and that sounds terrifying, but that figure isn't the thing that's predicting whether the cat's going to survive or not. And their prognosis can actually be pretty good.
So jump into this one with us. It is a complex topic. We are talking about cats after all, and they are nothing if not complex, but it's actually really interesting. And I think once you've done with this, you will have a much clearer plan and hopefully significantly more optimism the next time you look at that PCV tube and you go, oh, shit. This episode is one of our clinical episodes where I interview smart people like Dr. Rachel to ask them all of my dumb questions. You can find more than 600 other episodes like this one on all things small animal medicine, surgery, and ECC at vvn.supercast.com. That's VVN for Vetwald Network.supercast.com. Our friends at Diagnostics Pathology are bringing this one out of our subscriber-only feed and into your ears. Because A, it's such a great episode, and I know that I'm not the only one that struggles with these cases, so we really wanted to share it more widely. And B, if you practice in Australia, then Vetnostics will almost certainly be the ones helping you with your advanced diagnostics for anemic cats, and dogs for that matter, with their comprehensive PCR panels. In this episode, you will hear Dr. Rachel discuss when she reaches for these in her anemia workup and how to interpret your results better. If you're an Aussie vet, you already know the name Diagnostics Pathology, Australia's largest network of veterinary pathologists and internal medicine consultants, which means faster results, direct access to real experts, and support that actually solves problems. Diagnostics offers one of the most comprehensive and highly specialized test ranges in the country, so you are never left guessing. Supported by 4 core laboratories in Brisbane, Sydney, Melbourne, and Perth, plus a network of over 50 regional labs, you'll get answers fast, no matter where you are. And this isn't just a lab service, it's a diagnostic partnership. You'll collaborate with pathologists and internal medicine consultants who are there to help you deliver gold standard care. Plus, with a strong focus on ongoing education, like their support of this podcast, Vetnostics helps you stay sharp, current, and informed. So, don't be left guessing. Visit vetnostics.com.au and experience firsthand how Vetnostics Pathology can support you in delivering exceptional veterinary care. Okay, let's get more comfortable with anemic cats with Dr. Rachel Korman. Thank you so much for joining us on the Vet Vault for this topic I've been looking forward to for a long time. It's been on my wish list of topics for a while. We want to talk feline anemia, which I have to confess, and maybe you can help me. Hopefully this episode will change that, but I don't love anemic cats. Like, give me an anemic dog and I'm like, yeah, cool, this is an interesting challenge. I have my sort of algorithmic process in my brain of how am I going to figure out what it is, and most of them I feel like, yeah, we'll sort this out. Versus I do a PCV on a sick cat, I'm like, oh shit, this is going to be bad. Yeah. Is that justified at all, or am I just bad at managing them?
I think it's just that the whole aspect that, cats are different to dogs. And so you just need to get your head around a little bit more, what's normal, what's common, what's unusual, and how they kind of react to illnesses in different ways. And so for us, I think as sort of cat specialists, a lot of the cats that we're seeing are sick cats, and many sick cats will have a degree of anemia because cats are very, very good at developing an anemia of chronic disease for very vague reasons. So it's often something where you need to have it on your clinical radar. And then with any of those sorts of disease processes, it's just trying to keep a level head and work through the steps of, categorising what type of anemia you have and then what your differential diagnoses might be, and then just to start working through what's more likely and what's not.
So you talk about the categorizing of what type of anemia. And again, I have a very clear picture in my head for dogs, but it's the same for cats, right? So it's either you are losing red blood cells somewhere, so you're bleeding, or you are not producing red blood cells, so bone marrow or chronic disease, or you are breaking down red blood cells.
Yeah, correct.
The immune
So
system is decided.
Yeah, so I guess there's a couple of different ways that you can look at trying to classify anemias that way. And one of the simplest ways is just to say, is it hemorrhage? Is it reduced production, or is it increased destruction? And starting with that is often just the most basic kind of approach. So we tend to look at, is it regenerative or not regenerative? And then further splitting it into one of those three categories. Then you can also look at the DAMNIT V is what I would call it. There's probably other types of names for it, but that's where you go through and you look at the, degenerative diseases, anatomical or anomalous, metabolic, neoplastic, infectious. So that's when you're getting more into the nitty-gritty specific disease processes that way. And that can come sort of a little bit later once you've got more information about the patient.
Okay, so your algorithm is regenerative, non-regenerative, which will help you put it into one of those three buckets.
Correct.
And then from there, once you're in the right bucket, then you go, okay, here's the list of potential DDs.
Yeah,
right?
yeah, that's right. So, but I guess as with anything, there's always parts that are grey. And I think cats are just so good at doing grey, which is what makes it so difficult for everybody. So most of the time, I guess if you think about hemorrhage, you would expect that to be a regenerative anemia, unless you're in that time frame where it's pre-regenerative. So, that might be something where if you're really confident that this is about a hemorrhagic process, but you're still seeing a non-regenerative process, then recheck it in another couple of days and you'll probably start to see evidence of regeneration. And I guess on that note, we'll need to talk about how you differentiate non-regenerative from regenerative. But if we think about the hemolytic anemias as well, so cats do that a little bit differently too. So, they're also pretty good at developing a non-regenerative hemolytic anemia, which is where that destructive process of the immune system is actually targeting the precursors of red cells in the bone marrow. So you don't get any signs of regeneration. And that's typically something that's occurring in younger cats. So that can be what gives you the clue there. So it's thinking about the different buckets that you need to put things into, but just remembering that there's exceptions to the rule at times as well.
Yeah, that's right. Cats live in that grey zone in most diseases.
Exactly.
Did you, if you would decide to become a feline specialist, were you just like, normal medicine's too easy. Yeah. I want to make it much harder for myself.
I love making life difficult for myself. So
I just want to clarify what you said there about the hemolytic anemias being different in cats. Yeah. So we're talking about IMHA. Any other diseases in that bucket, or that's basically what it comes down to? So look,
I guess with the hemolytic anemias in cats, there's different causes as to why that might develop, and immune-mediated hemolytic anemias would be one type, but you can get drug-induced hemolytic anemia, you can get Heinz body anemia in cats as well. And, they're very prone to developing that because of the extra sulfur hydryl groups that their red cells have compared to humans and dogs. So it's really easy for their cells to become damaged and have oxidative damage. And then because their spleens are non-sinusoidal, the spleen is not very efficient at getting rid of sort of these cells. So a lot of them do get destroyed quite quickly. So with the hemolytic anemias, there's immune mediated, but then there's other causes, and I guess the infectious cause as well. So the Haemoplasma species in there as well.
Just skipping ahead. Should we get back to regenerative So step one, regenerative versus non-regenerative. So in my mind, that means I'm looking for do CBC and look for reticulocytes, basically different size red cells and different color red cells and that, or send it off to the lab and say that's regenerative.
Exactly, yes? Right. And so I would say it's 100% send stuff off to the lab. Like, I'm a huge fan of getting an external CBC done, and the clinical pathologists are so great at looking at everything and giving you really useful information. But I would say don't lose the art of looking at a smear in-house, because where it becomes incredibly important is those Friday night cases, or long weekends where you've got to manage a cat for 3 or 4 days until you can get sort of something back in that report. So being confident with your ability to look at a smear just comes with repetition. And so ideally, you take blood, you make 2 smears, look at one in-house yourself, send one externally, and then compare the information that you're getting with what you're seeing. And so when we're trying to look at whether they're regenerative or not, like you said, you look at the reticulocyte count, and that's normally it'll sort of spit out a percentage or an absolute count. And so I always just look at the absolute count. And obviously, if they're regenerating, that should be, above reference interval. And if they're not regenerating or they're pre-regenerative, it'll be within the reference interval. And then you can also look at the appearance, so the morphology of your red cells. So obviously, if you're regenerating, you'll have cells of different sizes, because you'll have cells that are younger cells in different ages. And you might also see things like a nucleated red blood cell, where it's sort of younger cells much, much faster.
So same as dogs. There's nothing specifically unique to looking at a regenerative cat smear versus a dog one.
No, that's it. So similar sort of process.
Great. So, but then you said cats will trick us because if they are hemolyzing, sometimes they won't. The immune systems will be destroying those reticulocytes.
Yeah, so the cytological appearance of an immune-mediated hemolytic process in cats will be different to dogs. So cats don't produce spherocytes the same way that dogs do. So in dogs, it's much easier to see spherocytes on the smear of a dog with IMHA, but often you don't see them in cats. And so the absence of spherocytes doesn't exclude a hemolytic process in a cat. Sometimes you'll see ghost cells in cats, which is where they have sort of very pale cells, and that can be sometimes a marker of a hemolytic process in a cat. But typically you'd also be looking for agglutination. So this is probably another thing to talk about, is cats, again, because of the difference in structure of their red blood cells and the nature of their red blood cells, they're very good at sort of sticking together. And typically you'll see what we call rouleau, which is like a stack of coins. So you've got, lots of cells on top of each other. Whereas agglutination is pathological typically, and it looks like a bunch of grapes kind of all together rather than stacked on top of each other. And that's where doing your saline agglutination test is helpful for differentiating what's pathological and what's not, because when you wash those cells, if it's not pathological, they'll stay separated, but if it is pathological, then they'll clump together and you'll see that macroscopic or microscopic agglutination under the microscope.
So just to clarify, rouleau, will you see rouleau on a stained smear versus a saline? Because again, when I'm working up my anemic patient, I will do the saline agglutination test. So once you've put saline in it, the rouleau will disappear. So if they're sticky then, if they're making those little clumps of grapes, versus if you just look at a smear and you go, oh, why are these red cells all sticky together?
Yeah.
That's so just cats being cats.
Yeah, that's right. So if it looks like a stack of coins, sort of one on top of the other, then that's a very normal thing that cats will do, and that's not a pathological process. But if it looks like a bunch of grapes all stuck together, and then you do a saline agglutination test and it's still looking like that, then that would definitely be, a marker for an immune mediated, or for a hemolytic process. Sorry, I should say, not necessarily immune mediated.
Sorry, I keep coming back into the nitty-gritty of immune-mediated disease. So in dogs, I know agglutination is a great indicator that it is, but the absence of by no means rules it out. Same thing in cats?
Yeah, that's right. So Rouleau is certainly not associated with any kind of pathological process. Sometimes, again, this is sort of there's exceptions to every rule. If you've got a cat who's got a really high protein level, so maybe a cat with FIP or a cat with multiple myeloma or something like that, where they've got a lot of huge amounts of plasma proteins, you'll see more rouleau and everything sticking together that way. But typically rouleau is not a pathological process, whereas agglutination certainly is.
But an anemic cat that does not have agglutination on a saline agglutination test doesn't mean that it's not immune mediated, just like in dogs, right?
Yeah.
The fact, if it's there, it's relevant,
Correct.
But if it's not there, it doesn't mean you can take it off the table.
Correct. Yeah. But it probably drops down the list a bit if you're not seeing it.
Hey nerds, I just need to interrupt you to tell you about more learning with the Vet Vault, but this time not online or alone in your car. In case you haven't heard, the Vet Vault has partnered with Vets on Tour, a boutique conference company that organizes world-class CE in world-class locations. In about 45 days, we'll be heading to the mountains of New Zealand to learn about the microbiome, about eyes, and, fittingly with this episode, cat viruses. But if you've missed out on this one, and we do still have about 9 more tickets left, by the way, for Wanaka, so it's not too late. Or even if you're already coming, but you need more snow and more fun with an epic group of attendees while you are sharpening your clinical knowledge, our Japan Snow Conference is now on sale. We're heading to a fabulous little mountain village called Nozawa Onsen. And if you didn't know, onsen means hot spring. Yes, there's a hot spring at the conference venue. No, it's not one of those you have to be naked ones. Bathing suits are allowed, in fact, encouraged. So this one is a week of deep powder, amazing traditional food in these tiny little snow-covered eateries, great company, world-class continuing education. We would love you to join us there. Both of these events are live at vetsontour.com. We can't wait to see you there. Okay, back to Dr. Rachel.
Maybe right back to the start, and we just say you've got a cat that comes in, and often the clinical signs of cats are really not inventive with the symptoms that they show. So like for different diseases, they do the same thing. It's just they're not coming out, they're not interacting, they're off their food, they're a bit more lethargic, and that could be any one of a million different disease processes, right? So,
not himself.
Yeah,
that's
exactly.
Normally the appointment.
or something like that. And so then you sort of start, your physical exam, and some cats may look pale, some cats maybe don't, some cats might sort of have a thready hyperdynamic pulse that gives you a clue that there's something cardiovascularly instability happening. Some cats will be tachycardic, some cats will be severely bradycardic if they're sort of very on the edge of arrest potentially. So physical exam can give you some of those clues. Temperature, cats with FIP, for example, maybe pyrexic, and we see a lot of anemia for different causes in cats with FIP. And then when we start to get into the laboratory testing, I guess the first thing that you're going to do is grab a blood sample for biochemistry, CBC, in-house or out-house, and 2 smears, one to look at yourself, one to send out, and then your PCV TP. So if we talk a little bit about just the PCV first, the information that you can get from that is it just guides you on the severity of your anemia. But one of the things many years ago, and I sound so ancient now, but we looked at a big group of cats in a referral population that came in for anemia, and we looked at the different causes of their anemia. But one of the things that we found from that was that the severity of anemia for cats when they're presenting to us initially is not something that's predictive of survival. And I think that's really important, particularly for the emergency guys, is you might have a cat with a PCV of 8% or 10%, and that sounds terrifying, but that figure isn't the thing that's predicting whether the cat's going to survive or not. And that's probably because when we have young cats with immune-mediated anemias, for example, their prognosis can actually be pretty good and they can do quite well. And so, it's just an important thing to realise that severity of anemia is not predictive of survival.
That's a very good point, because in my head, it is. If I see a cat with a sub 10 anemia, I'm like,
Oh, I'm
we're
not
in
saying you
big
don't
trouble.
lose sleep over it.
Yeah, yeah.
Like it's,
Yeah.
but it's just, it's not the thing where, you would then say, oh, you need to put this cat to sleep because of what a really severe anemia. Like the cat, particularly if it's young, may still have a very good prognosis. If you've got a super elderly cat, your diseases are going to be slightly different. You're thinking more along the lines of neoplasia or, bone marrow disorders. Then that population of cats would be different. But across the board, as far as prognosis goes, don't make it on the sort of severity of your PCV. And the other thing to look at with the PCV is just the color. Is it clear? Is it yellow? So then if you're seeing yellow, you'd start to think, is there a hemolytic process happening or not? And then we obviously start getting into the nitty-gritty of cytology, looking at red cell appearance, looking at your white cell line, looking at your platelets, and then a reticulocyte count.
Okay. Can I ask you about the PCV-TP? How low it goes, does that give you any clues as to DDs? And basically what I'm getting to is if it's an anemia of chronic disease,
yeah.
do they go super low, or do they tend to be like high 20s?
Typically, anemias of chronic disease, there's no specific cutoff, I guess, is the short answer to your question. But it would be unusual to get an anemia of chronic disease in a single digit number, if it's 8 or 9, something that would be unusual. Where it might happen is if you've got multiple disease processes sort of happening together. But typically anemia of chronic disease will be sort of the 15 to 25, something around that range.
Okay. And am I right? I get the feeling that cats handle anemia better, probably because it's more chronic often. But if you say 8, if I see a dog with 8, I'm like, yeah, you're pretty much dead. Whereas you see cats sometimes come in a single digit that doesn't even really show transfusion triggers. They'll be still cruising along.
And I guess for young players as well, that's probably a really important thing to have a think about, where you need to relate the number back to what your patient is doing as well. And what I mean by that is, if you've got a cat who's wandering around the consult room, still relatively bright, and it has a PCV of 8 or a PCV of 12, that anemia hasn't developed suddenly, right? That anemia has taken a long time to develop because the cat's been able to adjust to it. And so that immediately tells you that disease processes like hemorrhage are going to be pretty unlikely in that patient. And it's far more likely to be a slow degenerative process like a bone marrow disorder. And the same with some of the hemolytic diseases, they tend to be relatively fast in their progression. Whereas if you've got a cat who's collapsed, it's tachycardic, it's got bounding peripheral pulses, and it's got a PCV of 20, then you've got to be worried that it's going to get worse probably before it gets better from a PCV and patient perspective, and that there's something there that's happened relatively quickly. So the patient hasn't been able to adjust to that reduced oxygen carrying capacity.
Right. One more question on the PCV. You mentioned serum color. Mm-hmm. I feel like I heard somewhere that cats, well, you mentioned earlier, they break down red blood cells differently. So again, to me, a clear serum in a dog makes it way less likely that you're hemolytic.
Yeah.
But it's not the case with cats, am I right?
No, yeah, that's right. It's not quite the same in cats. So they tend to not really produce quite as much of sort of the bilirubin in hemolysis. And so if you've got severe kind of acute hemolysis, then they might have a significant increase in bilirubin, but not seeing it doesn't necessarily exclude a hemolytic process. Okay. And, there's lots of different reasons sort of for that, but it's mainly to do with sort of their way their liver can handle heme and the way that their spleen and sort of adjusts to the red blood cells and things as well. So we would only expect to see a very mild increase in bilirubin, and the absence of it doesn't exclude a hemolytic process necessarily either.
I'm right in saying cats are complicated.
Oh, yeah. Man. Welcome to my world. Never said that's the problem.
Way earlier, when you talked about looking at a smear to try and differentiate regenerative from non-regenerative, so you said sometimes they're non-regenerative because they've just started bleeding. How long is that window? How long between it's starting to happen until you start seeing those
Probably sort
regenerative
of 2 to
changes?
3 days before you'll start to see some regeneration.
long.
And in older cats, it can sometimes be a little bit longer as well because their bone marrow kind of can be a little bit sluggish, and then they'll start to regenerate. So it can be a little bit of a long time in older patients.
On the other end of the time scale, if you had a slow bleed, say you've got a GI bleed or something like that, do you get to the point where the regeneration disappears because they've run out of iron or...
Certainly. Yeah, it certainly can. And I guess we recognize that a little bit more in cats with other sort of processes happening. So there was a recent paper looking at cats with subcutaneous ureteral bypass catheters, so cells. And a lot of those cats can have a very mild cystitis and hematuria associated with the hardware that they have in their kidney and their bladder. And we're starting to recognise that some of those cats can get an iron deficiency anemia associated with the presence of the sub.
Okay. So we're trying to differentiate regenerative to non-regenerative. Those grey areas, the ones that don't quite, let's say I do a smear and there's no obvious regeneration. Other way. I look at it, I go, yes, there's obvious regeneration. Then I can put you in the bucket of hemorrhage or hemolysis. Am I right?
Correct.
That's right. If I don't see regeneration, then you're likely in the other bucket, but with those couple of caveats in the back of your head going, you could still be. But to help me decide, it sounds like history and clinical signs are going to help me be more suspicious of, as you said, if you are non-regenerative, but you are very sick with a modest, relatively with a 20 PCV, then I think I'm still thinking, well, you just started bleeding or you just started hemolyzing.
Correct.
Right?
Yeah, correct. Or you've got one of the non-regenerative hemolytic anemias that we see in cats where it's the precursors in the bone marrow that the immune system is targeting. Also, they're destroying the baby cells before they can get released into the circulation. So they look non-regenerative, or they are non-regenerative, but it's still a hemolytic process.
And are they fairly acute as well? To be a dog with IMHA they get sick really quickly. Is it an acute change in cats, or are they going to be more chronic?
A little bit. Well, probably a week or so of being not quite right. Yeah.
All right. So that doesn't really help. So again, that's where you're going to look for agglutination and other things.
Correct.
To try and decide.
Yeah,
okay.
correct.
Cool. Is it an appropriate place to give me an indication of most common causes, for horses versus zebras, of what are we thinking of in different age groups in cats, the anemic cat, especially if we have these vague ones? We do the initial tests and it hasn't given us much direction. What do you see fairly commonly as causes for anemia?
So I guess my brain tends to separate the diseases by kind of signaling of the patient, for example. So in young cats, we would tend to think about trauma, so hemorrhage, rodenticide toxicity, if they're outdoor cats, for example. We would think about Haemoplasma infections if they're male outdoor cats as well. So that's your Mycoplasma haemophilus infection. We would think about potentially FIP, in young cats as well. A lot of those cats have either an anemia of chronic disease or a hemolytic anemia potentially too. And then the immune-mediated processes also tend to affect the younger cats in that sort of 2 to 4 or 5 year age bracket. That's the primary IMHA. Secondary IMHAs that are triggered by neoplasia or other infectious processes can happen in any age, but the true primary ones tend to be in the younger cats. In the older age group population, most of those cats are probably going to be anemia of chronic disease. So, do you have a grumbling liver disorder? Do you have small cell lymphoma or large cell lymphoma, or do you have chronic kidney disease? And, they tend to be sort of the more common processes. And then we also, I guess, get the leukemias a little bit too, which can kind of happen in any age group.
So you say Haemoplasma, is that the new name for Mycoplasma
Oh, that's just kind of the group. And
Okay.
so then within that, you've got Mycoplasma, and I always get this wrong because it changes quite a bit, but there's Mycoplasma haemophilus, there's Haemominutium, and then there's Chiracensis as well. So there's sort of the three different species, or the one that is more pathological is Haemophilus, and Haemominutium and Chiracensis. They can still, not Chiracensis doesn't cause disease necessarily, but Haemominutium, if you get that on PCR in a cat, you really need to be looking for another cause of that cat's anemia, because it doesn't often cause clinically significant anemia. But we, a long time ago, sort of tracked it in cats, and we found that it did drop their PCV a little bit, but still it stayed within reference interval. So if you've got a cat with a pretty severe anemia, you run a Haemoplasma PCR and you get Myutium or Chiracensis, you need to look for another cause of that cat's anemia. If you get Haemophilus, that's probably your answer. It's probably that's causing the disease, and then you treat that as you need to.
Okay. In your list of DDs, you didn't mention the Mycoplasma for the older cats. They can obviously still get it, depending on lifestyle.
Yeah, exactly right. Yeah.
It's still on the list.
It's just that we would see more cats in that age group presenting with cancer or with kidney disease or something like that. They're often the cats where you will see the other species that are sort of non-pathological, if you like. So you might get a Haemominutium or a Chiracensis in those cats.
Okay. I want to ask a little bit of detail about Mycoplasma. Is this a good place? Or
I think that's a good place, yeah.
So that's one I often think of it if I have an anemic cat and I don't find any other causes.
Yeah.
Is it common?
Is it common? I feel like there's variation in regional prevalence. And so when I worked in the UK, we saw a lot, and we would see a lot of cats with severe anemias with haemophilus. I feel like I don't see that many now that I'm working in Brisbane. We certainly do isolate sort of the non-pathological species on PCR. And we routinely sort of PCR our blood donors, for example. So we will sometimes see them sort of pop up on that. But I see a lot less significant infections with haemophilus in Brisbane compared to when I worked in the UK. So I suspect there's a regional distribution for it.
But you get it globally.
Yeah, you do. So I think it's here. Like you've absolutely, the appropriate thing is to look for it and test for it. And so I guess if we talk about testing a little bit with that, we've got two main ways that we can test for it. One is looking for the organism cytologically, and one is doing a PCR. And hands down, without a doubt, PCR is the most sensitive and specific way to identify the organism, because there's just such an issue with false negative and false positive results looking cytologically. So it's very, very difficult to be confident with a diagnosis cytologically.
Right. That was going to be my question. So if it's the Friday 6 p.m. anemic cat and the age fits and everything else fits, and you do a blood smear and you go, I'm pretty sure that's that. Is that enough for you to treat on, or would you still say?
Yeah, so I guess in that circumstance, if we role play that a little bit out, so I would say you still send the PCR, right, if your owner can afford the cost of the PCR. So you send that out, but it might be a couple of days or a week until you get that back. But in front of you is a sick cat that's probably a younger cat that has a pretty severe anemia. And so you're not going to withhold treatment in that patient while you're waiting for that test result to come back. And if we talk about treatment a little bit, there's probably two main parts of treatment that we're looking at, but the biggest thing is doxycycline. You can also use fluoroquinolones as well, so marbafloxacin or pradafloxacin, but certainly the first go-to is going to be doxycycline. And it's such a safe drug, right, that even if the cat doesn't have that infection, you're really not going to rock the boat clinically by putting that cat onto doxycycline. So it's 100% the correct approach on a Friday night. Where it gets a little bit more tricky is, does the cat need a steroid? And so we certainly see a lot of cats with Haemoplasma infection. Doxycycline alone will be sufficient to treat that infection and get everything under control. And they may not necessarily need the immunosuppression that comes with prednisolone.
And immunosuppression is because these are, by definition, they're actually hemolytic anemias, right?
Yeah, correct.
The parasite sits on the red blood cells, and then the immune system's the thing that destroys the red blood cell.
What there probably is a degree of variation between the body being able to recognize that the parasite is there, it's foreign, and it's going to get rid of it. So appropriate hemolysis of an abnormal cell versus the Haemoplasma then triggering a sort of severe immune-mediated process that then just starts destroying cells regardless of what they're producing. And so when that process is happening, they're the cats that probably need the steroids in addition to the doxycycline. But telling the difference between the two, it can be quite difficult. And so in an ideal world, what you'd probably do would be maybe base it on, a Coombs test or the degree of agglutination that you're seeing, or maybe even just how severely affected the cat is, and you're just trying to cover all of your bases. But if your cat is kind of mildly affected and you want to just start with doxycycline and see how things go, then that would be appropriate. If your cat's severely affected, so, maybe has a severely low PCV, has transfusion triggers, has marked agglutination on a smear, maybe you've got the time to get a positive, to send off the Coombs, it's positive, they're the cats that you'd probably be reaching for prednisolone for sooner rather than later.
Okay. The doxy dose for this, is that just labeled dose, or do you have a specific recipes that you, because you've got the, those pastes that are convenient, do you just use?
Basically just sort of 10 milligrams per kilo per day for the doxy dose. And then it's just whether you give that as a single dose or whether you divide it is kind of based on probably how easy the cat is to administer medications to. So if it's super tricky, then I'd do the 10 mg once daily dosage. If they're relatively easy to medicate, then I'd split it, because I think the big doses of doxy in one hit can make them feel a bit nauseous. And I'd also try and make sure they have a bit of food with it as well, because if you're giving it on an empty stomach, it'll definitely make them feel pretty crummy.
Okay. And standard immunosuppressive doses, if you do decide to reach for it. So IMHA.
Yeah, correct.
Yeah. And again, you don't want to shortcut things, but if you're in a situation where you, for whatever reason, either cost or convenience, can't do all the things diagnostically that you want at the start. I have a young cat, it's anemic. Even if I make a smear and I don't see parasites, is it very wrong to go, I'm going to cover you with a bit of doxy just in case?
Oh, not at all.
A mycoplasma?
Not at all. No, I think that would be entirely appropriate.
Okay. So while you are trying to keep this cat alive, saying, well, let's see if we hit something that's causing this. If I can't find another obvious cause.
Yeah, because it's a safe drug, isn't it? Like it doesn't have a really bad side effect profile. So you're really not going to rock the boat by putting it onto doxycycline.
And because they're hemolytic, they go quite anemic, right? They can get very anemic.
Yeah, absolutely they can. Yeah, absolutely.
Are they going to show you regeneration? Based on what we talked about earlier? They should show you regeneration.
Yeah, correct.
Because that's not the immune-mediated, that's targeting the reticulocytes. That's going to be killing.
Yeah,
so they should show regeneration. So young cat regenerative anemia, are they pyrectic or anything else like that typically?
Yeah, they can be. So it certainly, but I guess as well, absence of pyrexia doesn't exclude it.
Okay. Does that cover Mycoplasma, or is there anything else we need
I think that covers it. I guess the main thing, probably just that PCR is really the most important thing. Treatment length, I guess, would be another thing, because no one really knows the appropriate time for treatment length, but it's probably going to be at least 2 to 4 weeks on the doxycycline. Okay. And then some cats, they can still become carriers potentially in the longer term. There's some research that suggests that following up with marbafloxacin after the doxycycline may reduce that load of carrier status afterwards. But I think if you just did a 2 to 4 week course of doxycycline, track the anemia, and if that's getting better, then great.
Great. Okay. You mentioned the PCRs a few times. So we have those I'm not sure about the rest of the world, but I'm sure they have similar things. Your feline anemia profiles.
Yeah.
Typically, what are they checking for?
Yeah, so they would be testing probably for the Haemoplasma species. So Haemophilus, Haemomynetium, and Chiracensis. So for the three. But again, it's the Haemophilus, which is the most pathological one we'd be looking at. And as far as kind of other organisms and things that they would be looking for, I guess it depends on the regional laboratory. There is I don't know too much about it because we don't have it here, but cytosine species that are, I think they're mainly in Europe, and I think they're another one that you can see cytologically. I don't know for sure whether there is a PCR or not. If there is, it's probably in America, I think, which is where, this organism is a bit more prevalent. Other panels might include things like some of the Babesia species. So we can see sort of species that do infect domestic cats. Again, it's not very common in Australia. I think this is something that you'd see more in sort of countries like South Africa and Europe, and it's been recorded in Asia as well. And also, I guess the other one would be the retroviruses, so FIV and FELV actually as well. And I probably should have included actually FELV in that differential list for the younger cats as well as a possibility for infection.
So FELV will typically cause a fairly significant anemia?
Oh,
right?
it can.
Or can
Yeah, it can do. But it's also more, I guess, just associated with development of potentially lymphoma or bone marrow leukemias and things like that. So it's all definitely worthwhile screening in the younger cats that are presenting with anemia.
Okay. So those profiles, so PCR is part of your workup, unless you have a very obvious, your cat comes in and then, I can see you're bleeding. But if it's a non-obvious diagnosis, worthwhile sending off to a lab.
So I guess where we would be running it would be, so let's say, for example, we have a cat that is middle age, let's call it 8, where it's the age where it can kind of be anything. And, we've got a PCV that is 15. So again, in that kind of bracket where it could be anything, it's kind of poorly regenerative. So that cat, we're going to be doing some screening work essentially on it. So we'd probably be looking at chest x-rays, abdominal ultrasound, looking for neoplasia, looking for abnormal organ appearance. And if we don't find anything at all there, then we'd be looking at sending off a PCR at that point potentially too. Okay.
And the PCRs in terms of sensitivity and specificity, could we trust what we see there? If it's it's relevant, if it's positive?
I guess it's probably not that straightforward. Again, with all things sort of cat related. Depends on the laboratory, depends on the PCR primer that they're using, and it's very difficult to get that information often when you need it. So that's where it becomes important to just look at the result and sort of tie it back to your patient. So say, for example, you get a positive result for cytosine, but, you live in Brisbane, then you think, actually, that's really doesn't really fit with what I'm seeing. So I'm just not sure that this is correct. Most of the tests, though, for the Haemoplasma species, they're going to be pretty reliable. Most of the tests for FIV are going to be reliable. FELV, the PCR, I guess, is going to be pretty good. Where you've got to be a little bit careful is with the in-house testing, just because the prevalence in some areas of FELV infection is quite low. And so you're more likely to sort of get a false positive. And so then just backing that test up, if you get a in-house positive, then make sure you back it up with either a second ELISA test and or a PCR at an external laboratory.
Okay. And in terms of just to recap, so the Haemoplasmas comes back, Mycoplasma haemophilus, yes, significant. That's likely to be why your cat's anemic. Correct. Versus the others. It's there. Do you treat them if you see them at all? Would you still go on doxy or not?
That's a really good question, and the answer is probably not. necessarily, because they're probably not really doing anything. And you'd be, so say, for example, you've got your cat with the PCV of 15 and it comes back and it's got chiricensis. That's not the answer. And so you need to be looking for another cause. And so, you follow that pathway.
Great. That helps a lot. Thank you. I'm trying to think if there's anything else diagnostically.
Some of the other things would be just check your platelet count. And that's something that is so easy to do in-house. And so many people don't do it. And in-house lab analyzers are inherently rubbish at getting the numbers right for cat platelets. So often you'll see really low numbers, but you absolutely just need to have a look at a blood smear and double check that their platelet counts are real. We certainly do see immune-mediated thrombocytopenia in cats. It's less common probably than in dogs, but we absolutely see it. We've treated a number of them here. And so it can definitely be a cause for hemorrhage in cats. So they'll often bleed from the nose, they might have some internal bleeding, but it's a real disease. Interestingly, we see less Evans syndrome, in cats. So in dogs, it seems to be pretty common to get both IMHA and IMTP. In cats, it's much less common, but we do see IMHA and then we do see IMTP in cats as well.
So with IMTPs, you should find evidence of bleeding somewhere. So you're going to see, okay, my cat's a bit anemic. It's also has low platelets, which I've confirmed on a smear. And you go, it could be, because IMTP I always struggle with to pull the trigger on treatment, because you go, it's low, but is it low because you're bleeding, or are you are you consuming them, or are you killing them?
Yeah, you've hit the nail on the head. It's really, really hard, and I've 100% got it wrong. I can think of one cat in particular where the cat came in with a history of being diagnosed as IMTP, and I thought, no, I think this cat actually just had a bleed for XYZ reason, and we pulled her off of steroids, but we tracked it, and we were looking closely at her platelets, and then lo and behold, her platelet count started sort of plummeting, and then we could actually see, no, actually this truly was about an immune-mediated process with the platelets, and she went back onto her steroids before there was any sort of catastrophic bleeding. But it 100% can be really difficult to tell that, is the platelet low because it's sitting in a big blood clot, or is it low because the body's destroying it? And what I would say is that the immune system is just so efficient at destroying platelets that if you see a cat, or a dog probably for that matter, and the platelets are negligible, to maybe, 0 per high-powered field or 1 per high-powered field, that's the immune system until proven otherwise, because it's just so efficient at getting rid of things it doesn't like.
But in those cats, you should be able to find evidence of bleeding somewhere. So it's going to be blood in the feces, or something
likely.
like that.
But sometimes it can be really difficult.
Oh, really?
Yeah. So I wouldn't necessarily, like if they're sitting with a platelet count between, I don't know, I'm sort of pulling a bit of a rough figure here, like between 100 and 150, something like that. I'd be watching them really carefully, but I wouldn't necessarily be assuming that's an IMTP or anything at that point. If I'm getting a platelet count of 10 or 15 or 20, less than 50 is kind of the line for spontaneous bleeding. I think you can see some cats that will spontaneously bleed with a slightly higher platelet count. And then there's others that are running around perfectly happy with a platelet count of 15 and, seem good.
Haven't bled yet.
Exactly. Yeah.
Okay. Do you ever need to go all the way down to bone marrow biopsies?
Yeah.
Is that something that happens, or do you usually get to your answer before you reach for those sort of things?
It's a really good question. And I would say we do them. We hate doing them is the honest answer.
I'm sure.
And but it's definitely something where, particularly for the non-regenerative processes, that's how you identify them, because you can see the arrest of the cell lines in the bone marrow. There's definitely some leukemic and thyroid leukemia processes where that's how you identify them. You should be looking for FELV potentially within the bone marrow itself. But often it's really hard to get good samples from the cat's marrow histologically. Like cytology you can often get, but getting a really good core sample can be difficult. And that can be because of pathology. If you've got severe fibrosis, a myelophysis in the bone marrow, that'll affect your sample. So I guess the short answer is that, yes, it is definitely a test that is appropriate in certain circumstances. Most of them will be the non-regenerative anemias. Often, though, practically, by the time you get to that point, you've gone through a lot of testing. So you've done a lot of diagnostic imaging, you've probably done a lot of laboratory work, looking for infectious diseases, Coombs, various different bits and pieces. And, you may have had a cat that's already had a blood transfusion, or, the cost is kind of mounting. And you've got to think about what are the treatable diseases that you're looking for. And the treatable diseases that we're looking for in the bone marrow will be the non-regenerative hemolytic anemias, or the sort of precursor hemolytic anemias. And so sometimes you take a little bit of a leap of faith, if you like, and you say to the owners, look, we can do this bone marrow test that'll cost you probably another $1,500 by the time you've anaesthetized the cat, done the sample, sent it off to the lab. Or we can treat for the treatable disease, which is a non-regenerative IMHA, and we put them on prednisolone plus or minus other immunosuppressives. If they get better, we're on the right track. If they're not, still could have been.
It's probably bad. Probably bad
disease, exactly. And so I would say, in my experience, most people go down that pathway.
Okay. All right. And that makes sense. That's pragmatic, which I love. The ones that I struggle a little bit with decision making are the ones that I think are secondary. So anemia of chronic disease. So let's say I have an older cat, it's anemic. I do my diagnostics and I go, yeah, you have kidney failure or, some other disease. Am I okay to stop at that point, and as far as the anemia goes, and says, well, let's manage the disease and hopefully the anemia comes right?
Yeah.
Or do you still need to keep digging to check, or is there something else going on as well?
Look, that's kind of a case-by-case basis, I think, and it would depend on the severity of the anemia as well. So if you've got a cat where, it's an older cat, you've found that it's, got chronic kidney disease, maybe its creatinine is 300, something like that, and it's got a PCB of 19, 20, 21 that's poorly regenerative or non-regenerative, that's probably your answer. And we should probably talk about erythropoietin or darbepoetin sort of treatment for that population of cats. But if you've got a cat where its PCV is sort of 18, 19 and its creatinine is 180, 200, it's only very mildly kind of acytemic, then that may not necessarily be your answer, because most of the anemias of renal disease are occurring late in the stage of their kidney disease. And so for those cats, you might then say, well, we also see inflammatory bowel disease and small cell lymphoma in that population of cats. So let's do a belly ultrasound. Let's, double check your intestinal wall layering. Let's look at a B12 level, for example, and just maybe do a little bit more digging to see if you can get to the bottom of it.
Okay, great. All right, let's talk about let's talk about all other things. So obviously in terms of treatment, we're not going to go into the individual diseases that cause anemia, but treat the disease if you can treat the disease. Give it steroids if it's hemolytic, doxy, all those things. But in terms of other things that help to address the anemia directly beyond transfusion, which again, we won't go down the transfusion route today. It's a whole different. I actually have a good episode on that.
What I will just quickly plug though is that we wrote a really nice, so it's a free access, public access transfusion guidelines with International Cat Care. So the Journal of Feline Medicine and Surgery. So if you just Google Journal of Feline Medicine and Surgery transfusion guidelines, and then you can download that for free, and that gives you all the information that you need about, getting donors, screening, how to administer, risks, all those sorts of things as well. So it's just a really great document. So take.
Amazing. Okay, so that's transfusion. Beyond that. Supplemental things that can help with the anemia. What's proven, what's rubbish, what helps?
Yeah, sure. So it depends on the disease process, I guess would be the first thing.
Okay.
B12, vitamin B12 in cats, I feel like I scatter it around like chicken feed. I use so much of it in so many cats. The more we find out about B12 deficiency in cats, the more we realize it's kind of involved in lots of different processes. And absolutely, there's reports of cats with pancytopenia and various different bits and pieces. I think it can cause I'm pulling this out of some ether of my brain, but like a macrocytosis as well. So big red cells in cats that have a very low B12. It's a very safe vitamin to give. It's a water-soluble vitamin. You're not going to overdose them if their B12 levels are normal and you give them an injection, and it absolutely can just make them feel a bit better and, get those processes back online. In an ideal world, you'd do a B12 assay and then follow it up with a series of injections. But a single B12 injection is probably going to be helpful.
Would that normally be some GI disease that's going to cause a B12 deficiency?
Exactly. Yeah, exactly right. Okay. So that'll be your inflammatory bowel disease, all cell lymphomas. Exocrine pancreatic insufficiency is another one that we see, cats that have really low B12. So that's sort of that population of cats. Iron deficiency, that's a bit of a tricky one because a lot of the cats that we see, they may have a functional iron disorder where their iron amount is appropriate, but their body's just not using it appropriately. And so there's all sorts of different fancy tests that you can do to look at iron body stores and functionality, but pragmatically giving them 0.5 ml of iron dextran intramuscularly probably isn't going to hurt. And so, that would be a reasonable thing in most cases to do. And then for the cats with chronic kidney disease or for the elderly anemic cats, and even to be honest, some people use darbepoetin, so like the EPO, in young cats with diseases like feline infectious peritonitis, where they do have a severe anemia, and we're just trying to kind of kickstart their bone marrow as quickly as we can. So they will regenerate at some point, but the EPO just kind of helps them get there a bit sooner.
How much B12 and how much darbepoetin? Is it a textbook dose?
So the B12 would just be 0.5 ml per cat, basically.
Okay.
Yeah. And the darbepoetin is, and look, it's really hard because there's been very little work done on darbepoetin publishing wise for a long time. But essentially it's a 1 microgram per kilo dosage. And you do that sort of once a week, and it's a subcut injection. You have to dilute it down into an appropriate fashion because it's a human syringe. It's pretty expensive depending on where in the world you are, but it's certainly something that makes a big difference to a lot of the cats when you start them on it. So it generally takes a couple of weeks for them to show a response. So you need to see them every week. Check their blood pressure because they can develop hypertension on it. Check their PCV-TP and then administer the darbepoetin. And then eventually you'll find that some of them will respond to it and their PCV will come up to, within normal limits. And then you can increase the time between injections. So you might go to every sort of 2 to 3 weeks, depending on the individual cat.
So those are kidney cats.
Yeah, exactly.
The kidneys are hanging in there, but they're a bit anemic.
Yeah, exactly. And the other place that I use it sometimes is just in older cats that probably do have an anemia of chronic disease. And they've got a mild non-regenerative anemia that's just not really going anywhere. And so we start them on darbepoetin. And some of them, you give them one injection and bam, their PCV comes up. But others need it for a little bit longer.
Okay. Rachel, it's a big topic. When I went into this, I've kind of, unless there's anything that I've obviously missed, I think we should stop there.
Sure.
Because there's all these little rabbit holes that you could go down. But I think, as you kept saying, probably some of these are separate episodes. I think it was a really nice overview. Are you happy with that? Or are you missing anything obvious?
No, I'm happy with that. I think it's, just the main thing, I guess, is just to not be scared of anemic cats. Stop panicking, put your thinking hat on and just think about the process, get a book out that gives you your differential lists and just start kind of working through, and just remember that the PCV at presentation isn't prognostic and a lot of these cats can do well.
I think, and again, that's important because I've had, maybe in my early career, because I didn't know what I was doing, I had bad experiences with anemic cats that didn't go well. And maybe it's because even just the transfusion.
I have bad experiences with anemic cats now. Like I don't
okay.
I don't think that never goes away.
I think I sort of got into the mindset of visit one, I see your cat sick, I see severe anemia, and I'm like, ugh. As you said earlier, maybe lean towards, this isn't going to go well. But it's important to hear you say that, no, they can't go well.
They can.
Just be systematic and figure it out, or refer it to Rachel if you're near Brisbane.
Right.
She likes a challenge.
I do, absolutely. Particularly in that young cat population, that's where these guys really, can come out the other side and do incredibly well.
I think probably what scares me, because the transfusion thing is so much more of a pain than a dog, so much more complicated. So you go, if you're very sick and you've got transfusion triggers, I almost am tempted to want to give up because I'm like, well, even just keep getting you through the next 48 hours is going to be hard. Before I even get to a diagnosis, I've got to save your life, which is intimidating if you're not doing it all the time.
Yeah, absolutely. And that's where, having the processes or some sort of a plan for feline transfusion is great. In different parts of the world, there are feline blood banks and things like that are available, checking with your local referral hospital if they've got a donation program and things like that. Or there's, obviously xenotransfusions with the use of dog blood that can, get patients out of trouble, but it's not a perfect solve. It comes with its own bag of trouble sometimes.
Rachel, thank you so much for your generous time. I know you're busy, but I think that was fantastic. I loved that.
Great.
Before you disappear, I wanted to tell you about my weekly newsletter. I speak to so many interesting people and learn so many new things while making the clinical podcast. So I thought I'd create a little summary each week of the stuff that stood out for me. We call it the Vetvault 321, and it consists of 3 clinical pearls. These are 3 things that I've taken away from making the clinical podcast episodes. My light bulb moments. 2 other things. These could be quotes, links, movies, books, a podcast highlight, maybe even from my own podcast. Anything that I've come across outside of clinical vetting that I think that you might find interesting. And then 1 thing to think about, which is usually something that I'm pondering this week and that I'd like you to ponder with me. If you'd like to get these in your inbox each week, then follow the newsletter link in the show description wherever you're listening. It's free, and I'd like to think it's useful. Okay, we'll see you next time.